Tricare, formerly known as Champus, the civilian health and medical program of the Uniformed Services, is the health care program serving active members and retired service members and their families worldwide. Tricare, which is funded by the federal government, uses military health care as its main delivery system, supported by a civilian network of providers and facilities. Many of the 9.6 million beneficiaries can receive cutting-edge health care at 56 military hospitals, 361 medical clinics, and 249 dental clinics, staffed by 137,000 military healthcare professionals. Tricare comes in 4 varieties: Tricare Prime, Tricare Extra, Tricare Standard, and Tricare for Life. The Tricare Prime option is very much like a health maintenance organization. Like an HMO, you're assigned to a primary care provider. This is usually, although not always, a military medical facility, on-base hospital, or medical clinic. You receive most of your healthcare needs through your PCP. Like most HMOs, in order to receive care from a specialist, you must first receive a referral from your PCP. Tricare Prime requires you to enroll and pay an annual enrollment fee. Plus, you pay a small fee called a cost share in the military each time you receive medical care. When you receive medical care under Tricare Prime, you don't have to file a reimbursement claim. The provider automatically does this for you. Tricare Prime is the most cost-effective Tricare option, but you generally have to live close to a military base to take advantage of it. The Tricare Standard and the Tricare Extra programs give you more flexibility than Tricare Prime, but it can result in additional costs. Under the Tricare Extra program, you can go to any Tricare network provider, TNP, present your military or dependent ID card, and receive medical care. After the annual deductible is paid, Tricare pays 80% of the medical expenses and you pay 20% of the authorized cost. TNPs do all the paperwork, so you don't have to file claims to being reimbursed. Under the Tricare Standard program, you can see just about any medical provider you want. As with Tricare Extra, you pay an annual deductible. In addition to the deductible, you have to pay 25% of what Tricare says the medical service should cost. Until a few years ago, when a retiree or a retiree family member reached the age of 65, they were no longer eligible for Tricare. Instead, they were expected to receive medical care under the provisions of Medicare. This changed in 2001 with the introduction of Tricare for Life. Under Tricare for Life, you receive your medical care from Medicare providers, but Tricare becomes a secondary insurer and picks up any cost that Medicare doesn't cover. You pay no annual deductible or cost share under this program. Tricare covers most inpatient and outpatient care that's medically necessary and considered proven. However, there are special rules or limits on certain types of care, while other types of care aren't covered at all. Some services or treatments require prior authorization. A few examples of medical procedures that aren't covered are CHAMPFA is a medical program through which the Department of Veterans Affairs helps pay the cost of medical services for eligible veterans, veterans' dependents, and the survivors of veterans. In some cases, a person may appear eligible for either program. However, anyone eligible for Tricare is eligible for CHAMPFA. Many veterans qualify for cost-free health care services based on a compensable service-connected condition or other qualifying factors. However, veterans with non-service connection conditions may be required to pay a copay for treatment if their gross household income exceeds the VA income limits. There are 4.6 million Tricare claims processed every week. Here's how claims are processed. Here's a list of reasons why a Tricare claim can be delayed or denied. With Tricare, there are many opportunities that would lead to improvements for patient access, healthy outcomes, and reductions in healthcare costs. Health on Wheels, a mobile health clinic that is soon to take flight, will be honoring America's veterans by providing convenient and exceptional healthcare that improves their health and well-being. Serving veterans because they've served us. Now here's a list of some of Tricare's terminology. This concludes my presentation on Tricare. Hope you enjoyed it. Thank you.